Welcome to the Cass Health Podcast, the show where we hope to connect our community with healthcare information that's relatable, understandable, and useful to your life, and where you get to know better the neighbors providing your care here. I'm your host, Ann McCurdy, and in today's episode, we're getting to know OBGYN, Dr. Amy Bingaman. Before we get started, two quick disclaimers. First, the comments in this podcast do not necessarily reflect the views of Cass Health. Second, the information in this podcast is not intended to be construed as personal medical advice. Always consult your primary care provider with your questions and concerns regarding your health. Dr. Bingaman, welcome to the Cass Health Podcast.
Well, thank you very much. My pleasure.
So first, we're going to just get to know you a little bit. So tell us about yourself.
Sure. It's kind of hard to sum up 50 years of your life, but I'll do it as briefly as I can. I was born in Chicago. I've lived in 6 different states. I graduated from high school in St. Louis. I traveled kind of all around, but I've lived in Iowa the longest now, so I consider myself an Iowan. I graduated from medical school a long time ago in 2002. I finished my residency in OBGYN with the Navy, so I did get 8.5 years of active duty time, which I'm quite proud of and very thankful for that support. And then I practiced in Des Moines for about 15 years at Unity Point, then Broadlawns, before I kind of went out on my own to serve rural communities and places that need the help for GYN care. I'm also married to a farmer. I have 4 kids and we have a lot of animals. So that's kind of sums it up a little bit.
Sounds like you keep very busy.
Very busy, yes.
So tell me a little bit about what drew you to medicine and what drew you into the career that you have and the specialty you chose.
So for me, I went into medicine because of my own personal experience. So my oldest son is now 34 years old. So I was pregnant as a teenager and I dropped out of high school. I lived in the projects in St. Louis. I had him in an inner city hospital. I was the recipient of Medicaid, which I'm also very thankful for that support that I received. And I did not receive very good care at the inner city hospital. So, his dad was Black and I was poor and on Medicaid. And so that experience really made me want to go into medicine and treat everyone the same, no matter how much or little money they had, the color of their skin, their gender identity, their handicap. Their culture. So that made me want to go into medicine. I certainly didn't think I'd be a doctor at that point. So I started for pre-nursing and did nursing school for a bit and then transferred over to get my BA in biology and then thankfully got into medical school. I really love kids, so I thought I would be a pediatrician, but I also found that I really love kids and pediatrics was hard for me to see any kind of, terminal diagnosis for kids. And then I discovered I really love surgery. Didn't really love the general surgery path. So what I found was that OBGYN was a perfect mix for me. I could connect really well with my patients. I enjoyed the variety between clinic, delivering, and doing GYN care. Of course, now that I'm in my 50s, I've stopped delivering just for a better life balance, but I have some of the most fondest memories of babies I've delivered over the years.
And here at Cass Health, you are not doing any obstetric care. You're exclusively doing gynecological care.
Correct.
So tell me about the types of patients you see and the types of services you provide here.
So I do full spectrum gynecologic care. So I'll see patients from very young ages all the way until death. So I take care of kind of the full gamut. Specific areas that I really am passionate about, adolescent GYN care. For obvious reasons, I was pregnant as a teenager. I really feel like I can connect with adolescents well. I also have been trained to do LGBTQ. So we started the first clinic in Des Moines for that. So I really get a lot of joy from taking care of that community that often has a hard time finding a good provider. And then as I started going through perimenopause and menopause myself, I realized how little I was taught formally about it, which I found frustrating. So I went ahead and got certified by the Menopause Society. So I am a menopause certified practitioner. So I see a lot of patients for perimenopause and menopause because, this is a huge part of our population. And there's a huge need for that, especially in the rural communities that really haven't had a lot of that service. And then we are getting the robot here at CAS. So I do a lot of robotic surgery. I've done well over 500 robotic surgeries. I proctor other surgeons on robotic surgery. So I think that's going to be a really exciting addition here at Cass County, where we make some procedures that would have been open, minimally invasive, same day, faster recovery time.
That's really exciting.
I know.
What an incredible service to women in our region.
Yeah.
So you're practicing independently now, and you're serving these rural areas. Do you want to say anything about, are you doing surgery in all those areas? Are you just doing surgery here?
Yeah, so I'm doing surgery everywhere I'm going. It has been really the most fulfilling chapter of my career to date. One, I grew up in cities, but we have a 350-acre farm that's in between Sheraton and Knoxville. So I've been trying to convince my husband since we came back to Iowa 16 years ago that I really am a farmer's wife. I think that I love the rural communities. I really like feeling like a part of the communities I'm going to. Even though I don't live here, I do feel like I'm part of the community. I've just loved the people that are working within the walls. I love the smaller feel. It's been incredibly rewarding. And for patients not to have to drive for surgery, it's been huge for the patients that I'm servicing.
What a fantastic answer. Yeah, we could talk all day, Dr. Bingaman.
Yes.
Seriously.
Yes.
Okay. So we're going to ask some fun questions. Just some
I'm ready.
Fun, get to know you.
All right.
Favorite sports team?
The Underdog. That's also my favorite song by Alicia Keys, Underdog. It's like the theme of my life.
I love it.
Yeah.
I love it. Okay. If you're cooking dinner to impress, what do you make?
Ooh, I'd like to say I'm a chef. I'm not really, but I love to cook and I love to entertain. So I'm in 3 book clubs and I try to do my menus off of the book club. So I have a lot of fun trying new things. I love making, my grandmother's parents came from Poland and she taught me Polish recipes. So I love making homemade pierogies and I kind of reserve those for special occasions. My grandma could do it relatively quickly. It's like a half-day process for me. So I enjoy making foods that have memories associated with them.
Love it. We're gonna deep dive into books sometime together.
Okay, the best book that I have read recently, and I'm embracing audiobooks because obviously I'm driving everywhere. And P.S. I have to get a hybrid because the gas prices are unbelievable. So that is on my to-do list. But outside of buying a cell phone, buying a car is my second least favorite activity in the whole wide world. So the best book that I've read, because I'm embracing audiobooks, is Theo in Golden.
It's excellent.
It was so good. I think it's a life-changing book, and that's the person I want to be when I retire.
Oh, yes, goals for sure.
Yeah.
That book just is the goodness and the kindness.
It's so wonderful.
I describe that book as a warm hug.
Yes, 100%.
Yes. What an excellent choice. Do you have a favorite holiday?
Well, my favorite holiday was always Christmas because I love gift giving. I love to give gifts and spoil people, and I make I make prime rib, beautiful Christmas Eve dinner. But I think that it may have changed to Halloween because at our farmhouse, we do a huge Halloween party where we have a haunted barn that's like commercial grade. And then we do a haunted hayrack ride through our little local cemetery. And the town has even gotten involved where they come running out from their houses carrying chainsaws at the kids in the hayrack. And then we do a big bonfire and we have a chili cook-off. And a costume contest and a live DJ. And so I think my new favorite holiday is probably Halloween because it's just such a fun party.
Oh, that's fantastic. And what did you dress up as for Halloween this last year?
This last year, I was an angel and my husband was a devil.
Oh, classic. Classic dress. Yeah. So hobbies, it sounds like reading and audiobooks right now at this phase of life. Any other hobbies?
I've ran 2 marathons after the age of 40 with no ACL on the right and a broken ankle on the left. So I would tell you that everybody can do it if you want to. It is going to go into my obituary. It was one of the hardest things I've ever done. But now I enjoy running just for my health. So typically like 3 to 5 miles, pretty slow, but I do enjoy being outside, exercising. We have a huge garden and orchard at the farm, so I enjoy gardening. I love traveling, if only it didn't cost a lot of money. But those are some of my outside interests for sure.
I think we'll wrap up with this. For new patients who are coming in to meet you, what do you want them to know about you and about having a good appointment with you? And just in general, what's that advice and what are those messages you want patients to know?
So I feel like I have a calling to do this. I don't feel like it's a job per se. So for me, when I meet a patient, if they're having issues or problems, my philosophy is that I talk about all the treatment options from doing nothing to everything that's out there, whether it's functional medicine, conventional medicine, surgical therapy. So my job is to educate and then help the patient decide on what's the right choice for them.
Fantastic.
Yeah.
So when you're driving alone in the car and you're not listening to an audiobook, what do you jam out to?
My marathon playlist music.
Okay, so what's on it? What's the pump-up music for your marathon?
Mostly, like, there's a lot of Eminem and Snoop Dogg, but then I also throw in some Dolly Parton and Reba McEntire. And it's just become this eclectic song list, especially because my kids, I have a 16-year-old, a 17-year-old, a 19-year-old, and then that oldest is 34 now. But having the teenagers, I end up being exposed to songs I haven't heard before. And I'm like, well, that Tyler, the Creator song's kind of fun. But he's a bit angry for me, so I don't do angry music.
Sure. But I love that fast pace.
Yeah.
That's going to keep you motivated,
Oh, yes.
right?
Yes.
Yeah. I might have to look at this playlist because it sounds pretty
Yes.
fire.
And then there's actually some meditations for commuting. So interestingly enough, obviously my career has been very high stress. I feel that my level of stress is lower than it's ever been in my career, probably from no longer doing OB and having overnights and weekends and that sort of thing. But I've kind of looked at a lot of the ways to help decrease stress because it's a bit annoying when you go see a doctor and they just say decrease your stress without giving some techniques. So a couple things that I found really helpful is meditation. I'm not great at it because I have a hard time turning my brain off, but they make 5-minute ones and then they make ones for commuting. So like it's specific when you're driving and stuck in the car that you can kind of go into this more peaceful space. There is a lot of evidence showing that does decrease our stress levels. Reading for pleasure definitely decreases stress levels. That's in a lot of studies. And then I started journaling, just a gratitude journal. It's very easy to do. And I think it kind of especially when you're having a bad day, being able to reflect on those things that you're grateful for, even in the midst of a day that you would hopefully never relive again.
These are fantastic answers. Is there anything we didn't talk about that you'd want people to know about you?
I think that women who empower other women are the most amazing people. So I really enjoy educating, whether it's educating the nurses I work with, colleagues, my patients, and I also love learning from other people. So I think that's another important thing, making sure that you have providers who never stop learning, who are always looking at things. And I've had patients teach me things where they've asked me about something that's not mainstream, and I am very comfortable saying, I am not familiar with that. Let me do a little research and get back to you. So I think of us more as a team, as a provider and the patient, and our goal is to improve your quality of life.
Wonderful. Dr. Bingaman, thank you so much for being on the Cass Health Podcast.
Well, you're quite welcome.
And we're going to definitely have you back to talk about perimenopause.
Oh, of course, yes.
Okay, thank you.
Yes, you're welcome.